Okay, so we're back, part 2. So we're talking about how to stop a bleed. That is important before you do anything else. So if the person is bleeding, obviously you need to do direct pressures. And sometimes you need to use some hemostatic agent. You don't need to use them all the time. In some condition, you need to use them. So a lot of people, they carry like the quick cloth or other products. And they're great. They're one of the issues that I have with quick cloth personally, and that it looks like a little, it's kind of a little square full of granules. And the problem with this one is that you cannot really, so when you do direct pressure, because a lot of people think it's only you do a direct pressure. So imagine that my bleed is over here. So basically I got my artery here that is cut, and this is what it's spurting over here. If I just apply pressure like this, I'm not doing direct pressure. Direct pressure means that I need to compress this so it narrows, so there's a clot that forms on it. And this is the problem with some of the hemostatic agent, is that they create a clot, yes, indirectly, but sometimes they won't work very well. So you want a product, any product, if you're going to carry some product, it has to be able to get it closer to the bleeding. Because how some products works is basically just by transfer of some ions, like for example sodium, some will be calcium, that will transfer some stuff to it, and basically there's a clot that forms. But you have to be close to the arteries, or hopefully it's not an artery, but most of the time you should use an arteries. But if you have a venous, even a venous bleed that is coming because somebody's on anticoagulant or something, that you don't want this. So basically you want a direct pressure. And when we talk about direct pressure, that means that your dressing and your fingers has to be right on this. And a lot of times the dressing that they have, and that's why I don't like the quick cloth, is because of this. So what I went with is the C-Lux, and this one is kind of for nosebleeds, but as you can see, it's very small. So what I can do is take two parts, and again, not try that, I'm just carrying it, we'll see, but you don't really need a lot of time. Like, we're not in the battlefield here, so I don't need as many times to most of the time, like I would say, I don't know, 95% of the time, your bleed will stop with just direct pressure, and a good direct pressure like this. Because a lot of times the problem is that people just apply a pressure like this. This is not direct pressure, it's just you're putting pressure on. The direct pressure is over here. So when you build actually your dressing, what you want to do is be almost like a reverse triangle. So if I'm here, I want a reverse triangle, so I want to stuff things right in there and then put my finger in it and put my direct pressure on it and leave that for a few minutes. That's not direct pressure. And so what I was thinking is using this product, because this one now I can use it also for nosebleeds. So basically would go in and use it, kind of becomes bigger, it's kind of a sponge. And so then you see it's very easy to carry, very small. And now I can put it at the end of my dressings that I'm going to put in the wound, and then just suck, put the pressure right on it. And basically, if I'm close from my arteries, this product will be kind of over here, create my clots and stop my bleeding. And again, when you're talking about wounds, it's important is the first layer. What you carry after that is not that important, but it's the first layer. If the first layer is good, because this is where that soup that I was telling you about will happen in what the bed of the wound we call. So for example, up to here, if I use good products, I can put gauze after that. I can put even a regular sponge if I want to suck the stuff, whatever. As long as I have a good layer between, like something that won't create the inflammatory process or anything like this. And we'll talk more about in the third part of improvising dressing. As long as I don't put some stuff over here that doesn't increase the inflammatory process, whatever I put on top, I can put a shirt if I want to. And this is the beauty of having, for example, that dressing that we were talking about. So basically, if I put this, whatever I'm going to put under to suck the exudate out so that I can bring him over here, doesn't matter, because the wound won't be affected, because it's over this. This is what's touching the wound, so this is what it counts. Just like when you get dressed, your first layer on you is the most important layer. Whatever you put on the top, of course, sometimes will help it or get worse, but what you want is keep the first layer, the most important layer that you're going to wear. So it's the same thing over here. So sometimes sponge will be important, especially for bleeding wounds and things like that. Here, I do not carry the medical sponge. First of all, they're very expensive. You can carry them and stuff. So instead, what I carry is just the good old maxi-pad. And the reason that I can go with maxi-pad, first of all, this is not maxi-pad, but is that multi-purpose. So now I can use this for starting a fire. I can use it for different things, as well as for its intended use. So for the ladies, and now I can use that as well for absorption of my thing. And I also carry usually a diaper, like a kid diaper. So for example, bigger wounds, I can put that. But now if I have those two layers, my wound that is under, this is not affecting the wound. If I put this straight on the wound, now I can increase my inflammatory process, and now I can bring a wound from an acute side to a chronic, just by increasing the inflammatory process of it. But by this, I take that, clean this, put it back, put something else. Oh, I ran out of this. Okay, I'm going to take my shirt, put my shirt on, whatever. And we're going to talk a little bit more about improvise, but you see the beauty of having a piece like this that you can cut, you can use, you can do a little bit of everything about it. So the sponge will be kind of your mid layer, and also talking about hemostasis. The other layer, now like the final layer, well, now there's two layers that could go, is your Gore-Tex. So basically your breathe that basically keeps it here. So once you put everything in, so depending if you need to take off some fluid, so for example, let's say I have something that is, there's a lot of exudate, so that means that, I got a lot of fluid coming out. So that means I need to have something that's going to absorb it. So I put something to absorb it, so either a sponge or whatever I have at the time, but I put a sponge, or I could put my pad, absorb the fluid so that I can kind of keep it over here. So let's say I did use an Aquacel, and then I put a pad on the top of it, and to make sure that the Aquacel don't stick to wounds. But for whatever reason, I want to be sure that it doesn't quick. So basically now this is my dressing. First of all, look at the size of this. Aquacel can stay in the wound for a long period of time, depending again of how much exudate comes out and everything. But this can almost be used one time, and it will almost like heal your wound. So this is the advantage of this versus how many. So this is the size of my dressing that I'm using right now. How much gauze? So go back on the gauze. How much gauze you think that I would have to use for the same dressing that's going to last me for a week? Well, it's about 4 or 5 gauze in the moderate exudate wound. 4 or 5 gauze twice a day or 3 times a day, depending. So that's 15 gauze times, let's say 7 days, just to make the calculation. So you got about 45 gauze that you need to carry. I got this. My wound will be healed, and plus my wound probably won't be healed because it'll go in an inflammatory process, more at risk for infection, because also my gauze probably will get wet, and because my gauze got wet, I increase my risk of maceration. Increasing my risk of maceration, it's like the cotton t-shirt that I throw. Doesn't dry very well. I get a lot of infection. The bacteria stays in. The bacteria, they stay in those microfibers that are there. So basically this stays in my wound, and it's almost like a vacuum. It sucks all the bacteria up and keeps a nice and dressing stuff. They're expensive, but worth their weight in gold, because look at the size of this thing. So that could be like a dressing. So now let's say my dressing is more on this category, which is more dry. Then I can use this. So let's say I do have or even let's say I don't have this. So let's say I have a road rash. So basically I just fell on my back, and like you scratch your arm on the ground. Well, I can just use this. Maybe there'll be some exudate, and we'll see what we can use it. I can use it over it. Take this, clean it, put it back in my first aid kit. So that could be another use of it. And like I was saying, now I'm trying it on prevent blisters as well. So the last layer that is important, so once you create that microclimate that is perfect for your wound, you don't want any water to go in, because now you work so hard to bring it to a place that you want it right in the middle. Well, now, if it starts raining, or if you take your shower, if you clean yourself or something, now you're going to bring water to there, meaning that you're going to bring it here. So you don't want that. And also, if you just let it cross, you know, like create a cross and everything, you're going back over here. So now we're not helping, because you need it wet, because the good cells and everything need to, they like a water. They like they're a little bit like swimmers, and they like a pool that is not too cold and not full of crap, but you know, a nice pool that they can swim in it and have fun, and with their little swimmers and everything, and like woo and swim in it. So they need a little pool, but if the pool is dry, they cannot go on the other side of it, and they'll stay on the side of the pool and just look. And so your wound won't do. And this is what a cross does. So you want to be able to play with both of those. So the thing that you can do to port that, and just like when you go in the outdoors, when you wear a Gore-Tex, basically the Gore-Tex bring your humidity out, but prevent the water, the rain to come in, is stuff like this. And this is called Thicoderm, but they're basically transparent film dressings. They have all kind of different names and stuff like that. But those, I carry a few, as you can see, I carry, and there's different size that I can carry and stuff like this. And the advantage to carry those ones is now I can put them over my wound, and basically this is my Gore-Tex. So basically I got my dressing like this, and now I put one of those, or as you can see, if it would be that long, then I would put two of those and stuff. The beauty with those ones, and again, look at the size, and I got 1, 2, 3. So I got 3 dressing here in that size. So and those are kind of like 75 cents, I think, or something. So you see like the size of those things, and what they're gonna do, they'll prevent the water to go in. So basically, if I have this correctly and well placed, and obviously, for example, if I'm a hairy part of my body here, I would probably have to make sure that it sticks very well and stuff, and we can use another product that I'll show you. What it will do is basically have a Gore-Tex on it, and the water won't go in, but it will breathe. They have like little particles inside, and it will breathe. And the beauty of this is that if it breathes, that means that it remains at that level if I use, again, the proper dressing under. So it's just like if I wore a big rain jacket, the perfect rain jacket, but I didn't put the right, I put a plastic bag on me under. It doesn't matter because I'm going to get wet all inside, so I can keep the water and everything, but no evaporation is going. So this is the beauty of those dressings, is that they'll let the air breathe if you put the proper dressing on top. And so this is what important is, like dress your wound like you dress yourself in the outdoors. And because of this, because now you can use different products for those ones. Ones that I use a lot, so if you don't ever find Band-Aid, so those are not Band-Aids. As you can see, they'll write Band-Aids on it, but they're not. They're special Band-Aids, and they're usually used for blisters. And what they do is basically, and I did a video in the past on what the products, and I tried them in the water and everything. The beauty with those ones is, as you can see, there's different size of them. So there's all different, and there used to be a company called Compede, and now like it's Band-Aid that took over for it, but you can pretty much find them all over the place. And there's different size, so you see like that's one of the size like this, and you have like, you know, the more regular size. The beauty with those things is that I can put that on for 7 days and it'll stick in, and that's the time I will heal for my wounds. And to make sure that those sticks in, because sometimes, you know, like for example, if I have air in my arm and everything, and I stick this in, it could move and stuff. This is where the Coban comes. And so, for example, a Coban will prevent water to kind of, it's a little bit waterproof a little bit, but if I have this, I can put Coban as well and stuff. So anyway, hopefully it was helpful, and talk to you soon.